How to treat a weaver fish sting. Surfers, swimmers, and beach walkers are at an increased risk stepping on a weaver fish. The weaver fish is the most venomous fish found in the coastal waters of Europe, the Black Sea, Mediterranean Sea, Eastern Atlantic Ocean, and the North Sea. With a size of 4 to 20 inches long, these fish are relatively small. They live in shallow water where they often bury themselves in the sand or mud, especially in the wave zones of beaches. The vast majority of injuries occur to the foot and are the result of stepping on the venomous spines of first dorsal fin and gills. To prevent weaver fish stings, shuffling of feet is recommended whenever walking in the water in coastal areas. Stings are most common in the hours before and after low tide. At first, many victims feel only a slight pain, like they have scratched themselves on a sharp object. 2 to 3 minutes after being stung, commonly severe pain begins and reaches a level that most victims describe as extremely painful. Pain typically peaks at 30 minutes, then resolves by 24 hours, but can persist for many days. Other accompanying symptoms like itching, swelling, heat, redness, numbness, tingling, nausea, vomiting, joint aches, headaches, abdominal cramps, lightheadedness, increased urination, and tremors may also occur. The treatment of a weaver fish sting. Step 1. Immersion in hot water. Soak the puncture site in as hot as tolerable water. Follow for a duration of approximately 30 to 90 minutes or until significant pain relief occurs. To inactivate toxins. Vinegar, urine, ammonia, or other substances added to the hot water have shown no benefit. The temperature denatures the proteins of the toxin. Repeat as necessary to control pain. Step 2. Remove any spines in the wound. Use tweezers to carefully remove any spines or other foreign material. If you have trouble removing a spine, you can try using a needle or a sterile safety pin to loosen it up. Step 3. Clean the wound. Scrub the wound with soap and water and then flush extensively with clean tap water. Do not close the wound, as puncture wounds should be left open. Usually, wound infections following a weaver fish sting are rare but still possible. Step 4. Seek medical attention. After first aid is rendered, a tetanus booster should be administered if the patient had not received the 3-dose series or if more than 10 years has elapsed since the previous dose. Additional pain management can be needed and administered by a health professional. Sometimes spines or foreign material can require to be removed surgically. Take regular doses of prescription-free over-the-counter pain medication to relieve pain if needed. Be sure to monitor the area for the first signs of infection, which include but are not necessarily limited to fever, increased redness, pus, thick drainage from the wound, increased pain, increased swelling. Is there any sign? Immediately visit a doctor. If stung by a weaver fish, seek medical treatment as soon as possible. Consult a doctor about treatment with available medications.